Hey everybody, so here is a consultation and treatment with one of our practitioners and a wonderful patient. I'll just kind of be talking through the whole consultation process and the treatment so you guys can get an idea of how it goes during your first treatment and what an initial acupuncture treatment really looks like. So when you guys go in for your first acupuncture session, you really want to make sure that your practitioner takes the time to go through a full consultation, really getting a good history on what's been going on, and taking a full intake. If you feel rushed or you just feel you're not really connecting with your practitioner, that is a sign that that practitioner or that practice may not be the best fit for you. So just keep that into consideration. You can see here that one of the practitioners here at the office is really taking their time and going into a deep detail about what the patient is complaining about. In this specific case, it was neck, shoulder, and back pain. So the question process, talks about where the pain originated. Was there any accidents? How did it happen? Has it happened before? Where is it hurting? What is the characteristic of the pain? All of those questions are asked by the practitioner to really get an idea of what's going on with the patient. Here you can see the patient is kind of just demonstrating and showing where or what movement that she does that really irritates or triggers that back. Along with her neck, she was having some issues with her neck as well. So just keep that in mind, that when you do go in for your first acupuncture treatment, it is really important that you feel heard, you feel connected, and you feel the practitioner took their time really getting to know what's going on with you and your body. So here you'll see that the consultation is coming to an end and the practitioner is getting ready to set the patient up for her treatment. You can see she's laying down some tissue for her to go down, and we kind of just cut the video into the treatment so we're not wasting time here. So you'll see we do try to stay as sanitary and clean as possible, so the practitioners generally do wear gloves, and here she is just palpating on the patient's back, really in those areas that the patient was complaining about. So there was neck, shoulder, back pain. Here she's just checking to see if her spine is nice and aligned or if she feels any deviation, and if she does, then that would be a referral to a different practitioner or a different office. Kind of just feeling the muscles there in the low back. And she does go on to say during this video that she does feel a lot of tension, a lot of tightness in this patient's back. So she's going to gear the treatment towards loosening all that stuff up and really getting the muscles to relax for her to feel better. All right, and slowly getting into the actual treatment. The practitioner has finished kind of diagnosing and palpating the patient's back. So she has an idea by her physical touch, and she has an idea through the consultation of what the patient said. And now she's moving forward with the actual treatment. And you can see here she is applying a little bit of lotion, non-scented hypoallergenic lotion, and she's getting ready to do the cupping on the back. She's going to be doing fire cupping, and that's mainly to get the muscles in her neck, shoulders, and back to loosen. As she did mention during the consultation here that while she was palpating her back, it did feel very tight. So here she's just making sure the back gets a nice thick coating of lotion, because she is going to be doing slide cupping. She's going to be placing the cups on the back and then sliding them into different areas of the back to help with circulation and muscle relaxation. There you go. The patient's giving you guys a thumbs up. She's feeling great. And you'll see that get started here in a second. So here the practitioner is kind of just explaining what she's going to be doing, and she's getting prepped. So usually with fire cupping, you are going to take a flammable substance. So here we're using cotton and 91% isopropyl alcohol, and she is going to light that cotton ball as you see here, and she's going to place that flame into a glass cup where it creates a negative pressure, placing that cup on the back and then creating that suction on the back. So here she is doing something called flash cupping or tap cupping. This is where you only let the cup stay on the skin for a few seconds before you pop it off, and it is designed to wake the muscles up, kind of breaking up any small tissue and helping circulation. And here now you can see she's doing some incorporating slide cupping. Again, that is for increasing circulation through the back. Now there are many different techniques with cupping. A practitioner can place the cups on your back and leave them there for maybe 15-20 minutes, even up to half an hour. Or they can do something where this practitioner here is doing, where she is sliding the cups or popping them off after a few seconds. It really just depends on your desired outcome and what you're trying to do as a practitioner, and that way you will change your style of cupping. Now guys, keep in mind, we are using a flame here, so you want to make sure that the practitioner that you are getting treated by, you feel safe and you feel they're doing things properly, even though sometimes it's tough to gauge, because we don't know, as a patient you may not know what to expect or what is proper and what not. But for the most part, you want to feel like your practitioner knows what they're doing. If they are dealing with an open flame, they generally want to keep it away from any clothing or any other flammable substance. You want to make sure generally they are wearing gloves and taking the necessary steps to make sure you're protected against catching any of the flame or any other potential hazard during the treatment. As you can see here, this practitioner is starting to do the flash cupping, where it's putting the cup on the back, making sure that it's sealed and that it has a nice grasp against the skin. And she's adding a few up on the upper neck. And when you see her put it on and take it off within just a couple seconds, that's flash cupping. That's generally used to increase circulation through the back. So if there are tight muscles or muscles that are causing some strain or pain for the patient, that type of technique would be used. Here you can see she is transitioning to more of a slide cupping. That's technically used for the same kind of issue. It is more of an aggressive type of treatment. Some love the way it feels and others not so much. It can feel like more of a pulling on the skin, which can be a little uncomfortable to some. But some people love that sensation. Now it is on a case-by-case basis. Each patient is going to be treated in a different manner. There isn't one treatment that fits all. So if you do end up coming to our office and you get a practitioner, they're going to kind of assess during the consultation which type of cupping treatment would be best for you and which would give you the most relief. If it is something like achy muscles, tightness, knots, things of that sort, they may opt to do slide cupping, or they may do flash cupping. In very rare cases do we do, at this specific office here at Balance Within in Encino, in very rare cases do we do stationary cupping, where we put the cups on your back and then we'll just leave them for 20-30 minutes. Some practitioners do opt to do that in different offices. We typically don't do that here. One, because it typically leaves heavy bruising on the skin, which we don't like to do. Sometimes with cupping you'll see the dark circles around the back, and if we do stationary cupping, it does exacerbate those bruises along the back, which we don't like to do. So typically we will opt to do more of a slide or flash cupping. Here you can see the practitioners. She should be on her way, kind of wrapping up the treatment. She's done her flash cupping and her slide cupping. Now she's letting the cups sit for just a few more minutes. Here she goes, opting to do the flash cupping again. And the concept of this is really just to get blood and oxygen to move through this back area where there's generally a lot of tightness, achy, and strained muscles. We do tend to hold a lot of tension in these areas, and this is a great technique to get that tension to dissolve. Now, this patient was really tight in her neck, shoulders, and back, so the practitioner here opted to do another round, filling the back with the glass cups all the way down from the waist up to the neck and shoulders. And she's going to follow this with doing a little bit more slide cupping and leaving them stationary for just a couple minutes, no longer than maybe 2 minutes. So this patient may walk away with slightly darker circles on the back than you see now. So I hope this little video has helped create a bit more understanding about what different types of cupping treatments there are and when to use it. Just remember that when there are tight, achy muscles or muscles that you generally may work out a lot, especially if you're a runner or swimmer, cupping is a great alternative treatment. One, to just get those muscles to relax, get them to function a little easier and smoother. Two, to get that lactic acid buildup out of the muscle so you can perform better. I hope this was an informative video. If you guys have any questions or concerns, feel free to reach out to us. You can call, text, or email. And again, thanks for watching.